to see it at the end of the session. Other than that, Cynthia, I turn it over to you.
Well, I kind of wanted to preempt this with why we have a speaker on ticks, because it is our least favorite topic as hikers. We don't want to think about them. We don't want to believe that they're crawling on us or possibly infecting us. And, you know, we certainly don't want to look for them. But in facing our fears, we probably need to get educated on them. Last year in June, I went hiking in the UP with a friend, and in one day, we collectively had 42 ticks in June.
Wow.
So that woke me up and said, you better get educated because you have a nemesis here. I think it was shortly after that I contacted Dr. Tsao. We thought June wasn't that hot, we wouldn't have a problem. Well, it turns out June is the highest tick incident month of the year. So that's one of the things I've learned just by studying up with Dr. Tsao. So with that, I would like to introduce Dr. Tsao, who is our, I think, one of our lead experts in ticks in Michigan. Since she's the only one I know, I think she's the lead tick expert in Michigan. And she has 20 years of experience studying ticks. So if anyone has more than that, please bring them forward now. But thank you for coming, Dr. Tsao. We really appreciate you educating us. And I know it's hard to juggle the science because you're a very scientific person, but if you could dumb it down, we appreciate it. Thank you.
Well, thank you very much for having me. And I was going to say, I am maybe the tick expert in Michigan, but in part, there's just a very small pool, and we are training lots of good people here too. And there's lots of people at the state health department, and more in the local health department. So hopefully we'll have a cadre. Let me share my screen. Thank you all for attending, being here. And initially, I'm going to have a disclaimer. Initially, okay, I think it's going to go soon. Hold on. Cynthia had said 20 minutes and I was like, 20 minutes? Okay, 20 minutes, I can do it. But then she said that I had the privilege, of having more time. But now, as like many academics, I'm hoping that I will get through all I have. But if I don't, my contact information is right there. And,
wild rice.
oops, I was going to say, I love wild rice too. But if we could, if people could mute their Zooms, that would be helpful, I think, for everyone else. I know what I'm going to say here. But so I wanted to say, here we go. Let's see. Hopefully after this talk today, I'm going to try to cover all this, but basically there's a lot there, but basically as Cynthia had asked, just to give an overview of what are the tick species that people in Michigan here are most likely to contact, and what are some of the tick-borne pathogens we should be most aware of, and really when and where should we be concerned, because the most important thing, as hikers, people who enjoy the outdoors, you and I, we just want to make sure we do what we can to prevent a tick bite, right? That's most important. So the way I've broken up the talk is really to have, oops, I'll jump ahead, but really to have sections about the ticks, and then the prevention section, all right? So about the ticks and where they are in Michigan, and then the prevention section. I am happy to take any questions during this if but I think Cynthia said she would help monitor and say, I think, and Cynthia, you can, wave your hand or just break in, and Eric too, because I may not see the questions there. So if we think the questions are more appropriate to take, for instance, there have been like two halves here. Right after the first half is really kind of and the second half is the prevention. So if you want to take me, if you would like me to take the question after the first half, we can do that. And I hear myself. Cynthia, I think as host, you have the ability to
mute people.
You look on the participant list, you'll see the microphone.
Okay, let me try that.
Because they may have stepped away, not heard ask
Um,
to mute.
I see an iPhone gentleman with his on, but I can't figure out how to mute him.
All right, I'll try to mute it myself. I'm sorry.
It's okay.
I'm able to mute people if I see that they're unmuted. So let me go
Okay.
through the people and see.
I think this problem is solved because we don't hear an echo. So there
Okay.
we go.
I
All
see
right,
a couple
great.
of people. Yeah, still Lorraine. Penny.
All right. Okay, well, I'll go ahead.
Yep.
A lot of the information that I'm going to present in this first part is actually, I wanted to show you, it really comes from this resource at the health department from MDHHS. And so they have one document.
Uh-oh.
I'm gonna stop a little because I don't want to.
I don't know who is not muted. Leslie, are you muted? Amy, Ben
Okay,
Shepherd.
why do you have such crappy phones? I got nothing.
Okay, Amy Van Shepherd, you're on. Okay.
All right.
Sounds good. Sounds like we're
Okay.
good.
Good. All right. So again, if you go to the health department's website, Michigan Department of Health and Human Services, you click this is their emerging infectious disease site. They will have some resources there, lots of them, and about emerging diseases, but including tick-borne diseases. They have one report here that's reporting the trends of tick-borne disease from 2016 to 2020. And then there's another one that is their annual one. So they publish an annual one every year. And you can also find out information about West Nile virus, about rabies, waterborne diseases too. So here are the graphics for them. And I'll really highlight some data from there because they get the whole picture about disease, which is why we're interested, right? So what's important is here in Michigan and many of our surrounding states too, the top 3 ticks that people contact are number 1, the dog tick, and many people might know it as the wood tick. Number 2 would be the black-legged tick, and several people know it as the deer tick, and then the Lone Star tick, which is pretty rare here in Michigan, but it's starting to become a little bit more common. But if you go to, let's say, Indiana, you like hiking down in Indiana, you'll bump into more Lone Star ticks. And certainly on the other side, on Wisconsin, you'll bump into a lot of dog ticks and black-legged ticks. But overall, these are the main ticks. And so you can see this ticking counter, I'll highlight too, is a great resource. If you need information about ticks, obviously the CDC, the health department in the state, they'll have information, but I've borrowed some pictures from Ticking Counter, and overall it's a great outreach website about ticks, all right? So these ticks that we often contact, you can see there are different sizes, there are different colors. And so for a tick biologist, you know, I'm always asking people when they tell me they have ticks, oh, what did it look like? But I think I reacted to mosquitoes the way most people probably react to ticks. When a mosquito bites me, my colleagues ask me, oh, what kind? What did it look like? And I'm like, I don't know. I just smashed it. You know, I just flicked it away. But as you'll see later, it's very important if you can, you know, learn to try to identify the ticks to some degree, and there are resources to help you because different ticks transmit different pathogens, and that can be pretty important then, both for helping yourself realize, should I be worried about Lyme disease or not, for instance, or when you go see a doctor because you feel you might be sick, to help the doctor narrow down which pathogen you may have been exposed to, right? Right. So this talk will talk mostly about the Lyme disease vector, the black-legged tick, or also known as the deer tick, because that's the tick that actually causes the most disease in Michigan. And actually, that's the case in North America. right? And so here what you see is you see the adult female that has a red back and adult male. They're bigger than the other stages. And those are the ones that actually could be out today. We were just talking right before the call, the talk started, but whenever it's above about 40 degrees, the adult stage tick can be active. And so the fall, the winter, and the spring. And then you see at the bottom left, that little thing has 6 legs. That's the larva. So that's the youngest stage. And then you have the nymph, the bottom right, 8 legs, and a kind of a miniature version of the male. And that's the stage that causes the most disease, and you have to really watch out for, right? In addition to Lyme disease, this tick is also responsible for several other diseases. So anaplasmosis is the second one. That's and right now in Michigan, I'll show some numbers. The numbers have really started to increase, but it's still kind of low. Powassan virus and babesiosis are rare here. And then we've not really detected ehrlichiosis or hard tick relapsing fever. But those are pathogens and diseases that have been seen in some of the, like in other areas in the upper Midwest.
Video or anything.
And then also over in the Northeast. So at some point,
Sit on a couch.
probably appear in Michigan. So I'll show you some data that shows that the Lyme disease anaplasmosis has increased here in Michigan. But why is that? And because many of you, I'm sure, have known that you used to hike 10 years ago, 20 years ago, 30 years ago, and we didn't seem to be so concerned about Lyme disease, especially, I was mentioning to Joe that I was, as an undergraduate, I had worked out at Kellogg Biological Station in 1992, and there were dog ticks, perhaps, but no Lyme disease ticks. It wasn't a problem. And then my students and I did research at Kellogg Biological Station from 2004 to 2009. Maybe at the end, we started seeing the black-legged tick, but really they hadn't been around. And then all of a sudden, I think starting around 2013, 2014, they started to increase. And talking with veterinarians in that area, they definitely saw the same thing because they started seeing more ticks on their patients and started seeing antibodies against the Lyme disease pathogen. So, what's happened? The ticks, the black-legged tick has been spreading across the eastern US, and Michigan is an example, what I've highlighted here, as how the tick has been spreading, and you can see. So the yellow counties are ones where they know that the tick could survive here and be established because of weather conditions and climate and such. And also the host communities are fine. So we have deer, we have mice, we have birds, but they just hadn't been here. And slowly over time, you see red counties indicating where these ticks have become established and then been increasing. All right. And so we can talk more about why that might be in the future later on, but this is the trend. All right. And so Michigan is still actually considered a low incidence state for Lyme disease when you by the CDC, but these numbers are increasing, and also certain counties actually, even according to the criteria of the CDC, would be considered high incidence. And right now in the UP, I've highlighted with stars the counties that have, those are the counties with the highest incidence in Michigan, but the darker counties that you see on the right, they all have higher incidence. And they're mostly, you can see, on the west side of the state, and a little bit over on the northeast. But last year, 2021, the year that the health department has the data for, 864 people had confirmed and or probable cases of Lyme disease. And Cynthia had asked me, she had previewed a bunch of these slides, asking about, what does that number mean, really? And Lyme disease, just like any other reportable disease that the CDC has, they have strict criteria for the definitions, and also physicians or labs, there's a protocol for how they are reported. But certainly not all cases are reported, and not all cases might meet the strict epidemiological case definitions. But the reason why they have these strict definitions is so that they can compare the data from one year to another and from state to state. But Lyme disease is a clinically diagnosed disease. So whether or not it gets counted, by the CDC or not, if a doctor believes someone has Lyme disease, then they have Lyme disease, but they might not necessarily get counted depending on whether or not the doctor sends that information in. In the state of Michigan, most states actually, if a lab test is run on a patient and it becomes positive, then that is automatically kicked to the state health department, and then they will investigate. But if there's no lab test done, then the case won't, then it really just depends on whether or not the doctor makes an official diagnosis that gets recorded somewhere that then would be sent into the state. All right, but to diagnose Lyme disease in Michigan, especially in these areas that are darker county, the darker counties, a lab test is not necessary. If the doctor thinks you have Lyme disease and then you get the drugs and you get better, we presume it was, and that's it. But technically speaking, they should report it to the health department, but it's a lot of paperwork. So anyway, the CDC has done a study where actually they have checked to see when doctors have I guess coded, and I don't know, we may have doctors online who can talk about this more, but there are certain codes that they can code in for disease, and the CDC has maybe looked for also just symptoms and drugs, so in a different way, they've kind of dredged the data to try to see, what could be the overall number of Lyme disease. And what they have found is that the numbers of cases that are actually reported to the CDC is tenfold less than what they think is out there. So they're not trying to hide the data or anything, but it's just the way the system works. So about 35 to 40,000 cases are reported annually now, but they believe that number, in terms of the numbers of people who actually have Lyme disease, is more like 350 to 400,000. All right, so you may have seen some literature on that. So it's a lot of people, and it is the leading vector-borne disease. So not only is the leading tick-borne disease, but it's the leading vector-borne disease. Anaplasmosis is the second one, but it's tenfold less. All right, and in part it's because of its ecology. It's harder to maintain in nature. All right, so it's transmitted by the same tick, but it's just the way the biology is. You just don't have that much out there, and so people contact it less too. All right. So the right map is what I just shown you, where the highest incidence has been found in Michigan from 2017 to 2021. So that's why there's a little sick person over there. But on the left are data on what the proportion of ticks that have been collected, mainly by my lab, but also by several health departments around the state. But when those ticks have been assayed for pathogens, what you see here, again, with the darker counties, they have a higher prevalence or a higher proportion of ticks infected with the Lyme disease pathogen. So here, then, you can see again that the darker counties are more on the western side of the UP, and also more so on the western side of the Lower Peninsula, with other, bits in the eastern Lake Huron side, and happening to have a little bit more and more towards, Ann Arbor, Detroit area now. But certainly where your chapter is located, there's definitely, a lot of activity of infected ticks around. I just would caution, like if you see the white counties, it says no ticks collected. And so in part, that could be because there was no effort to collect, or there was effort, but not enough ticks collected to be able to assay for infection, right? Because some of these areas, the infection prevalence is so low that if you have a small sample size to collect, even if the pathogen were there, you would not be able to detect it. All right. So the CDC sometimes makes decisions about not testing because it's just not worth it. All right, but you see this pattern, and you'll see this pattern again reflected later on for anaplasma, I'll show you, and in terms of disease. So those two maps, when you are considered together, both the proportion of ticks that are infected around the state, as well as the number of people that are found to be infected where they can rule out travel, all right, to another county and such, those are the ingredients that are put together to make this Lyme disease risk map. And so if you were to look at this risk map going back to like year 2009 or so, you would see red counties, which are the counties with known risk, again, in very limited areas in the UP, and then also limited areas in basically, again, southwestern Michigan. But then over time, you've gotten more and more red counties. And then the counties that are next to the red counties, they automatically get that stippled color. And so it's just potential risk. It's called, because the data are collected such that, you know, you really don't know if really at that borderline between one county or the next, the risk would just disappear. So, and then the white counties, again, are counties where either there's just no information, or there have been, for instance, ticks collected, but just no ticks have been detected as having the pathogen. All right, so you still should be careful that you shouldn't assume that the white counties are without risk. And as this map gets filled in more and more and more, I think the assumption is that you should just be careful whenever you go out hiking and recreating in these areas, or working in your gardens if you have other cottages in some of these areas, such that you just take the precautions to avoid ticks. So I wanted to say, from a One Health perspective, and certainly my lab has always also worked with veterinarians, the data that is coming in from the veterinary side is really helps to define the picture as well, and helps support this idea that, especially in a place like Michigan where the ticks are invading, that there can be risk in many places, but certainly that there's higher risk right now in certain areas, such as, again, you can see, and that's on the right side map, darker counties, again, in the western UP, and then also darker counties over here, on the western side of the Lower Peninsula. And again, those two little counties over there on the northeastern part of the Lower Peninsula. And so these data, in case you don't know, I know some of you have dogs, we just saw some, but every year your dog has to be, you have to test your dog for antibodies to heartworm, right? Because then that's how you can then get the heartworm medication. So when you do that, depending on the tests your vet orders and probably in consultation with you, these tests will simultaneously look for antibodies, which would indicate exposure to the Lyme disease pathogen, as well as to the anaplasma pathogen, as well as to another one, or Ehrlichia pathogen. And then those data, when they come back, they actually get fed into this national system, where CAPC is the organization that collates it. It's a Companion Animal Parasite Council. And you can look up that website, and they actually have a lot of information there also to help provide you information on preventing tick-borne diseases, heartworm, etc. And so this data, like the CDC data, has a few problems in this, mainly, especially because we're looking at mapping disease risk. They don't take into account travel. So in the CDC data, they don't take into account human travel. And in the CAPC here, they don't take into account like dog travel, right? However, having said that, there are so many people that show up on the CDC, maps for where they get infected. I mean, for cases of Lyme disease, and there are so many dogs that are represented. Like this map represents 500,000 dogs at least, and so there's so many individuals that, even if there is some noise from travel, any signal that you see here is probably indicative of some real signal in nature, all right? And these data, we know them because we and others have collected the ticks also, they really do reflect that pattern. And the reason I bring this up is, well, first of all, as a reminder, but probably most of you know, you should protect your dogs against ticks. Right? And there are good ways to do it, some better ways than we have for protecting ourselves. And then number two, I do think, because It's very difficult and expensive to have people go out and collect ticks to try to understand where the risk of Lyme disease and other pathogens are. That this data set that CAPC is collecting and curating over time, even if it has some problems, overall, I think it's a really good indicator of where risk will be. So I really try to bring this up, especially because I'm in the vet school, really try to highlight that in order to understand the risk of ticks and tick-borne diseases, we should try to have multiple lines of evidence. And I feel the dog data is really good. And so you can go on their website and you look at their maps from 2017 to 2022, and they do forecasts also. And because they get so much data from veterinarians, the turnaround time that they have for predicting is also, it's better, faster than it is for, let's say, the state of Michigan, any of this, and not, any state, and also for the CDC as well. All right. All right, so here's anaplasmosis. So anaplasmosis is caused by, it's a bacterial disease, and it's also the pathogens transmitted by the same tick. And before this year, the number of cases in the last 5 years was about 61. And then all of a sudden, this past year, they had about 65 cases. So, or 56 cases. And so there's been a jump. The graph at the bottom left just shows that the number of cases over time from May to November, December. And so you see that there are more cases in June, in the middle of summer than early summer. And that's a similar seasonality for Lyme disease, because it's the same tick, basically. And you can see on the map here on the right, again, the number of cases, and here they've controlled for county population sizes so that you can really compare among the counties where the relative risk is. And so you can see again, that's much higher up in the Western UP, and then also in that Ludington, Manistee area. All right. And then putting together again the data from the ticks that my lab and the state health, our local health departments have collected, you can see then, where anaplasma has popped up in ticks in the vegetation. That's the left map. And then these were the cases from 2016 to 2020. So they didn't include the 2021 cases in the middle. And then there you go. There's the CAPC data for anaplasmosis seropositives. So you see a pattern. So basically, if I were to quiz you guys, where you should definitely be careful about contacting ticks, I'm sure you'd be able to tell me just from looking at these maps. All right. And then, not to make you more paranoid, but again, we talked about how knowledge is better, but from those same ticks, the CDC also looked for several other pathogens. And so basically every county there that's lit up is we have detected the Lyme disease pathogen, but then with each of those counties, you see several combinations of other of ticks infected with those other pathogens. And so the darker counties down at the bottom have 3 or 4 pathogens that have been found. And so again, the most dark counties, again, we have one down in the Southwest, Berrien County, and then Menominee County up in the UP, but certainly lots of pathogens throughout this area. And this is not atypical. If we were to look in Wisconsin, Minnesota, which have had these ticks established for much longer, you would see the same, and they would probably have a lot more dark blue and black colored counties. All right. And so I would be remiss to not talk about some of the other ticks, because actually the dog tick represents about 80% of the ticks that people in Michigan contact. And they don't transmit the Lyme disease pathogen.
They have that, and he did have that in the presentation. I actually asked him to take out all of the different grade level, because you're talking about another, 10 to 15 slides.
Hopefully he's talking about another slide presentation, but it could be similar to mine.
How to impact each of the individual students. So I just wanted you to know that.
All right. So the dog tick, lucky for us, doesn't really transmit many pathogens. It does transmit some awful pathogens though. So Rocky Mountain spotted fever, for example, is fatal. Tularemia is pretty bad too. But the proportion of these ticks that are infected are so low that these diseases are not really considered a major threat here in Michigan. However, we'd always say you should still be on the lookout if you have been bitten by a tick and you get sick, because it is the situation that you could die from Rocky Mountain spotted fever. All right. So, but in the last 5 years or so, although there have been Michiganders who have come down with Rocky Mountain spotted fever or something that's serologically similar, only 2 were exposed here in Michigan, but the rest were through travel somewhere else. All right. But the seasonality of when these ticks come out, and it's really just the adult stages, overlaps completely with when the Lyme disease tick is out in the spring and grading into part of July and August too.
Jean?
Yes, Eric.
We got a couple of questions as far as any first aid that should be given, and also symptoms if bitten, and maybe you're going to get to that.
Yeah,
And then
I think
one last question about maybe eradicating on a governmental scale to try and get rid of some of these ticks, but I don't know if you can talk into that.
Well, I will just say, I will talk about some of these, whatchamacallit, the symptoms. Well, I actually won't talk too much about disease, but in general, for a tick-borne disease, and what makes it, difficult sometimes to diagnose is that it's a fever. You feel flu-like, symptoms, fever and malaise, and the thing that it will cue most people that it might be Lyme disease is that it's the seasonality or anaplasmosis. Most of these diseases occur in summer. So when you're not worried about flu or RSV, or anything like that as much. All right, so that's the epidemiology that helps. So it's more of a spring, summer type of disease, and then and it won't be, flu and such. However, having said that, people can get infected by the adult ticks of the Lyme disease, and I do have a seasonality graph later. But those, generally speaking, most people aren't infected by the adult stage, but by the nymphs, which is mainly then we do mainly worry about it in the summer. All right, so here I'll just show this slide here, jump to it. But you can see here from January to December in the bottom left graph, this is where in 2020, the cases were reported that the state had then mapped out here in a graph. And so you see again, the peak cases occur in late spring, early summer, right? And what I've indicated there is for the most part, the nymph, that teenage stage, is the vector that's most important in the middle of the summer. The adult stage, which is these females being shown here, they're active around the, kind of flanking that time frame. And so people still can get infected from them, but most of the risk is in the middle of the summer. Anaplasmosis then follows, very similar time frame, seasonality of these diseases. And then the other diseases that this tick transmits, there aren't enough cases that you could, even draw a curve like this. But from the areas like the Northeast, as well as in Minnesota and Wisconsin, if you looked in those areas where they have many more of those other cases, i.e. babesiosis, you would see a very similar pattern. All right, so the epidemiology really helps clue people into saying that this is a tick-borne disease. And
Most
then,
of us think of a tick as being embedded and sucking and getting full of your blood. Do the nymphs also embed and suck the blood and swell up, or do
all
they
of
just
them.
bite and leave you?
Yeah, so a tick has to, that's their job. They want to get a full blood meal from you. And so the nymphal stage takes about 4 days, around 4 days, maybe 6 days, to get replete with blood, whereas the adult stage is like 7 to 10 days. And so that's why we tell people to check themselves frequently, especially early on, because I have another slide here that shows that the reason why we say check for tick so much is not just because it's gross and you don't want to have a tick on you, but it's because the longer they suck on you, the greater the probability that they can transmit a pathogen. So this is a table that shows that that for various pathogens, most are bacteria, but not all, the tick has to be feeding for a certain amount of time before it can transmit. And so the scary one, and I've listed it in terms of from the shortest duration to the greatest, but the Powassan virus is like, it's in the same family as West Nile virus. So it's not and it has a high fatality rate, and or if you survive it, you don't do very well, kind of like Eastern equine encephalitis, which people, you guys where you live, you are aware of, but that has a very short time to transmit. And so that can be, so that you can become paranoid about if you're, in terms of you're not checking for ticks all the time, and you would have to. However, having said that, that prevalence, the proportion of ticks infected in Michigan is, so low. I think there was one case of it, but in the 2000 range, I think 2000 to 2010 and or earlier, I can't remember, but we haven't had a case here and in a long time. And then Borrelia burgdorferi, the Lyme disease pathogen, takes at least 36 hours to transmit. Borrelia mayonii is another Lyme disease spirochete, the type of bacteria that causes it. We have found it in Michigan, but again, very low numbers. But the two of them, they cause Lyme disease. They're treated the same, but they require more time to transmit. And that's why we say, if you can check yourself for ticks and find them either before they attach to you or before they have fed 24, 36 hours, your chances of becoming infected, even if the tick's infected, are very low. And again, some of these other pathogens take less time, but they're found in lower prevalences here in Michigan. And the Rickettsia rickettsii, that's actually the dog tick. All right. So it's on this table because we're talking about these pathogens transmitted by these ticks, the dog tick and the black-legged tick, which are common, but the proportion of ticks infected with Rickettsia rickettsii, which is the Rocky Mountain spotted fever bacterium, is just really low here in Michigan. So I don't want people to freak out about that.
So Jean, this is Cynthia. If somebody finds a tick and, first thing, brush it off, get rid of it, right? If you can, but if it's already embedding, I think the thing to do is to get the tick and save it so that if you go to the doctor, you have the tick. Is that true? And then you get treated with antibiotics or whatever you need. The doctor can then discern from the tick, right? Better discern.
Exactly.
And I have a tick key that I'd like to show y'all. This is a tick key. You should have one with you on your day pack or your backpack. And what that does, there's a recessed surface here on the key part. And so you would look through the key, see the tick, put it into the larger part, and then pull down so that it comes off with the smaller part. So everyone should have one of these. They're on Amazon. I have like 6.
And have they worked well for you for flat ticks as well as if they've got a little blood in them?
Well, I am so paranoid, Jean, that I've only had a couple that have been partially embedded, and they came off fine with that.
Great.
Because if you catch them soon enough, yes.
That's
What
right.
would you suggest if we find a tick that is embedded more?
Yeah, so how about I just jump to that part?
Okay, great.
Well, actually, can I just let me just back up here and I'll start with the prevention, all right here. All
And
right.
someone just said the key doesn't work well on nymphs, just to input that.
Right, and that's the thing. Right, that's why I wanted to ask you, and I think you were mainly talking about adult ticks with me previously, but the nymph is smaller, so if they had a smaller key, that might work better. But actually, that little pivot in there, it should work well too. But so for prevention, all right, so in the past slides, I was just telling you about the ticks, all right, and there were a few more slides there I can go back to later if we want, but for the most part, you got the picture, the spatial risk of these various the tick-borne diseases that are important in Michigan. So in terms of prevention, then, I mean, I've kind of broken it down to kind of, know before you go, and then the checking for the ticks and what to do if you find a tick and how to get it off, right? And so you had mentioned, Cynthia, that's why I said, let me go back a little bit prior to then just finding the tick, what you should do, because you had said it in your backpack, right? You should have, or your fanny pack, something like that. So I've tried to lay it out because you are hikers and you are like professional hikers. You plan, you're just not necessarily going. And even if you just go for a hike, because you've had experience, you think about these things. So take the same approach then to thinking about prevention of ticks. The same way that you might think about if you go to the beach to lay out, you want sunscreen, or if you're going bicycling, what do you want to have? A helmet, extra spare tire, a pump, things like that, or just, your cell phone to call for help. But basically prepare, materials. So what might you want? All right. First of all, and someone wrote it right here, Matt, or Matt's, or Deb Matt's. Yeah. So what I have here, all right, they are the EPA registered. That means they've been tested and vetted, all right, repellents. And so basically DEET, really good. Picaridin, IR3535, terrible name, don't, yeah. And then oil of lemon eucalyptus, or PMD, is the active ingredient, and 2-undecanone. And I mentioned the last two because even picaridin, though, I mean, they are derived from some naturally found repellents. They've been now chemically synthesized, but if people would like to have something that doesn't sound, as synthetic, like DEET or IR3535, those are options, all right? And I know DEET sometimes seems scary to people and melts plastic, but really, no, they have not found any, for all the doses of DEET that people have used, for decades, they really have not found any negative adverse, consequences of DEET, unless people have seriously, literally, drunk the DEET, or really applied it, I think, in a way that it was not meant. All right. So read the labels. Okay. And there was information about what you should use for kids under 3 and all that kind of stuff, right? And also people often ask, what about if you get, you want to use sunscreen and repellent? They say to apply the sunscreen first, repellent second, because somehow having the repellent first, it does somehow increase the amount of absorption that goes in if you put the sunscreen on top. Reapply as necessary. If you're sweating and all that kind of stuff, just like with sunscreen, you'll want to reapply faster than whatever the label says. All right. And I have in bold here, there are a lot of natural people online probably will say, oh, tincture of rosemary oil or whatever, these natural oils, they might be effective. Well, yes, they might be effective, but you don't know for how long they're effective and at what dose. All right. So that's why we say use kind of one of these repellents that are registered at the EPA. And then, as Cynthia just wrote, permethrin. So permethrin is excellent, and it's originally from chrysanthemums, all right? But now obviously it's like synthesized here. But the CDC has this graphic here on how to apply it to your clothes. If you do DIY, I think I talked with Cynthia and Eric about, like, you can also buy permethrin that's in a liquid form that you would actually not spray, but you soak your clothes with. Either's fine, just read the instructions, do what they say. They're good for several washes. You can also often now buy clothes from your local outdoor recreation store that's already pre-treated with permethrin. And some of those say they're good for 60 or 70 washes. Always still check against ticks, check for ticks, even if you use these precautions. There's no silver bullet, all right? But permethrin's really good, especially if you hike a lot, you work in your gardens a lot. Wear the same clothes. All right. So the backpack, right? So when you go hiking, if a lot of your fears will be eliminated or, reduced a bit, hopefully, if you make sure you have your repellent, you have your tick key, or just another pair of fine tips tweezers. All right. And a plastic baggie or a vial to prevent, I mean, in the case that you do get a tick, then you can put it in there. And I like to have a marker, so that you can write down when you found it, where, and then maybe you might want to have like a little magnifying glass. Some of you might have little magnifying glasses because you're naturalists, you're looking at plants and such, so maybe, and it might help to look for ticks, right? And then obviously, then we have lots of hand sanitizer now, often because we're post-COVID, or I don't know if we're really post-COVID, mid-post-COVID. And then, and maybe, because when you're hiking, you might have injuries, you might already be carrying around some kind of antibiotic ointment like Neosporin. Might as well throw that in this pack, Have a tick ID card. The Michigan Department of Health has a tick ID card you can order, or I have this little logo on here, the Tick app. I'm part of I helped create this mobile health app that has information about ticks, everything I've talked about today and stuff I haven't talked about. You can access that information on the Tick app. All right. So you can load that onto your phone, on your smartphone, or you could just look online. But anyway, that app has information about these ticks, how to identify them, etc. Because as Cynthia said, we want to try to avoid ticks, but if you see one, you want to keep it actually, because then you can try to identify it, whether or not then, it's a tick that can transmit Lyme disease bacterium, or is it one that's more for Rocky Mountain spotted fever, etc. And so, after having your pack ready, and you can have like a small one, a mini, fanny pack when you're camping, hiking, or you got a backpack that you have in your car. You can have some of the stuff that's in the car. You can have this these materials in a fanny pack or a backpack in your house, so when you come back, but just have this, it's as if you're, whatever you would take when you go hiking because you want to avoid the rain or hike through the rain. And, these are just the things that would, allow you to enjoy nature and be, try to be safe about it, right? So the next thing is, just like I'm sure many of you do when you go hiking, you pick a place you want to go to, and you probably want to know, oh, should I be worried? Like, what kind of footwear should I wear? Because, is there a higher grade? Is there a lower grade? All that kind of stuff. So then you can think about what's the potential risk for ticks, wherever you're going. And so know when, where, what kind of habitats you'll be going to try to avoid these questing ticks. And questing is the word we use to show when ticks are actively host seeking. And so you can see with these two ticks, that's the nymph on the left and the adult female on the right of the black-legged tick, and that has its front pairs of legs out raised. All right. And it's because they don't have antennae like insects do, but their sensory organs are at the tips of their legs, the front pair. And so they wave them around. And this is how they can sense if a host comes by, they can hop on. A host like you, a host like your dog. All right. And so, anyway, these questing ticks are the ones that might get on you. And that's why you want to try to wear repellent and such that it seems like they might still come on us, as opposed to mosquitoes. When you spray repellent, mosquitoes come near you, they smell it, and they'll go away. But ticks actually might not do that. These ticks, they might still come on you, but then they start tasting you or the repellent, and they're like, ugh, gross. And then they leave. All right. So, anyway, so then knowing when, and so I showed you this slide before, all right, when you might be at risk. And so again, the spring and the late spring, early summer is like the most risky time for getting Lyme disease. And that's because it's the nymph that is basically, the perpetrator. And so the nymph, only about 10, depending where you are in Michigan, it could be actually very low, 5%, but it could be about 25 to 30% of those nymphs are infected with the Lyme disease pathogen. And then a much, much, much lower proportion for the other pathogens. But because they're smaller, we miss them. And so most people who get Lyme disease never see this nymph that's feeding on them, even though it has to feed about 4. I mean, if you never saw it, it's probably it's fed to repletion and then got off, and that would be like 4 days or so. So even though the adults, I'll tell you, the adults, about 40% can be infected with the Lyme disease pathogen. And that seems huge, right? A huge proportion, almost 1 out of 2. And in some places, maybe 1 out of 2. But I don't show you the male because the male does not feed. So you take away, from the adult population, half of them because the male doesn't feed. Its job is just to find a female and inseminate her to make the next generation, So the male doesn't feed, just like male mosquitoes.
I
So
was
you
gonna
don't-
move that plant tomorrow.
Yeah,
or you
you
can
don't
move
have
it
to
now.
worry about the males. All right.
I just didn't want to move it today with the sun.
So we're leaving that, so can I just put it over there and take the stool out?
There's someone that we're hearing. Could you check your microphone, please, and turn it off?
And then the other thing is that this female, because she's bigger and she's got a red, like second, bottom half door, of her, right, the posterior half, we see her actually much sooner than we see the nymphs, if we ever do. And because of that, she gets thwarted in her quest to feed on us and then infect us. So even if she's already started to embed and feed us, we usually find her soon enough to take her off before she's had enough time to transmit. And so, yes, we do see people, like I said, who, do get infected with Lyme disease in the times where the adults are active and the nymphs are not, but it's much lower. All right. So, all right. And then I just wanted to, show again, I'm trying to go backwards, that again, to contrast the adult dog ticks, those other stages, they never are really on people, but the adult dog tick kind of is around the same time is when the, coinciding with when the nymphal and some of the adult black-legged ticks are. Again, that's why it's good to know if you can recognize them so that you can alleviate your fears of whether or not you might get Lyme disease or anaplasmosis. All right. So then, and then know where the risk is. All right. So in general, you've seen that, you know that. So in general, some counties are higher risk than others. And then habitat. So you often will see, and your experience too, you often get ticks in grassy areas. Grassy areas, however, are really the habitat that the dog tick favors. The black-legged tick, the Lyme disease tick, is much more of a woodland tick. Right. And so the top two photos are much more areas where it would be higher risk for the Lyme disease tick, and the bottom two photos are much more for the dog tick. And you can actually see the signs that are warning people actually show that the difference in the ticks there. And then I'll just mention the Lone Star tick, which is creeping into Michigan, found mainly established populations in Berrien County. It is kind of in between. It's definitely, it is more of a woodland tick, but you can find it on the grassy areas. And similarly, you can find the black-legged tick in the grass and the dog tick in the woods. It's just because they're adjacent to each other or something like that. But for the most part, those are the two different habitats. So stay on the trail. That's the main point. Because you hike, so I'm not going to say, and I hike, I love being outside. I'm not going to stay out of these habitats. The ticks love them. We love them. We agree on that, right? But you should stay on the path where the risk is lower because they are questing from the vegetation. So then when you're in the woods, all right, as you're walking, just like Cynthia and your friend, you were in the UP doing this, you should just, from time to time, check yourself for ticks. Make it second nature. Make it just a habit, right? It's just like making sure your helmet is adjusted right from when you're biking, making sure that you have enough sunscreen on. Well, just check for ticks, all right? And then epidemiologically, they have found that when people shower bathe within 2 hours of coming home from their activity or 2 hours of gardening in their yard, if you're in one of these counties with higher risk of Lyme, these folks, because they take off all their clothes, they have a chance then to really inspect their bodies and find any potentially walking around ticks or embedded ticks. But 2 hours, 4 hours, not enough to transmit. So that's a really good habit to make. All right. And then the other thing is actually these ticks are really prone to drying out. So, sometimes you have ticks that are hitchhiking. They haven't started feeding on you. Well, your clothes, put them into the dryer, dry them for 10 minutes on high heat, and then the ticks will die. Washing does not, even with hot, on hot, does not do as good of a job. They've done the experiments on that. And the ticks can survive the water. They're a little waterlogged, but they can survive. And if somehow they make it out, then there's still a potential vector for your pet or for you. But if you do this drying then that'll take care of the risk from the hitchhikers on the clothes. And Tick and Counter has this great little poster, little card they put up in the shower stalls. I'm sorry, in the bathroom stalls. And so they just say, again, checking ticks just a habit. So when you're sitting there, on the toilet, go ahead, check yourself. All right. And again, most people never see the tick that infected. And again, I'm showing you the difference. So these nymphal ticks are the size of these poppy seeds. All right. And the adult female, they say, is more like sesame seeds. And the CDC had this great meme that they got a lot of flack for from the lemon poppy seed muffin lobby, but they had lemon poppy seed muffins and they glued some black-legged nymphs on there, and you really could not see the you had to look carefully to see the legs. That's their size. All right. So we saw this slide. And then, so here we go. Like when you see a tick, don't panic, keep it. So this is then just the ones that are crawling around. All right. And so why do we even want to save those? First of all, part of it is that even if they haven't embedded, now that it's kind of like knowing who your enemy might be right there, who you have exposed yourself to, all right, even though you've caught them before they have fed. And it's good to keep that, because what if you get sick later on, right? And you don't have a tick at that point. Well, it's possible that you may have been exposed to the same type of tick that you did find crawling. It's just that you didn't see that other one, all right? But also then it's just, again, alleviating your fears, whether it might be, is it a vector for the Lyme disease tick or not? Because again, 80% of the ticks that Michiganders contact, we know this because they submit the ticks or submit pictures, are the dog tick. All right. So have your tick card. You can also take a photo of your tick, try to get a clear photo. You can send it to the state health department through that program in the bottom left. Or again, if you have the tick app, the mobile app, that I'm part of, you can take a photo and upload it. For both of these, within a day or two, you'll get information back about that tick, as long as they can identify it through the image. And Tick Spotters is part of Tick and Counter, and they do the same thing, and they're great as well. And so IDing the ticks, you'll learn yourself about what the different species of ticks are and be able to correlate with potentially your risk for a tick-borne pathogen. But then again, later on, if you do get sick, you have some information to tell the doctor that perhaps it could be a tick-borne disease, and perhaps it could be due to one of these types of ticks. All right. Now, all right. If you do find a tick that's embedded, Cynthia's already said, remove it, tick key or with tweezers. And the CDC has these great pictures. You want to make sure that you grab the tick, and this is why the tick key is good, from the closest point of attachment to the skin. All right. And it's not necessarily because if you grab it from the butt area that you'll squeeze any pathogen into you. For this tick, doesn't seem like that's a high probability. All right. But the point is, if you've done that and you grab it, you might just break it, because those mouth parts are really lodged in. That's their job over evolutionary time. They've got backward, barbs and facing barbs. They have a cement that they put down. They're locked in. And so you've just broken the tick in half. And so it just allows for potentially a secondary infection, not necessarily from the pathogen, but that you have a hole there and it's got, this mouth parts kind of stuck there. And there can be, another bacterial disease from your skin. Right. So, but don't panic if it does happen. Just do your best to take the to get it out. You don't have to scrape out the mouth parts. Just clean it and put some Neosporin on. And importantly, no Vaseline. Don't try to dig the tick out with a knife. And if you don't have tweezers and such, some people will say, slip a credit card, something like that, in between the tick at the closest point of attachment again, and try to just take, with your fingers, try to between the credit card and the mouth parts, just pull out. All right. And then the important thing is to keep the tick. All right. Get it identified. So you can use one of the sources I just told you about, or if you're very worried, you can go see a doctor, and the doctor can also have the tick sent in to be identified. All right.
Jane,
Yes,
Yeah, we have some people that are just signing in because they thought the meeting started at 8. If we could, this is Eric from Chief Noonday. We are recording this, and if you did sign in, we apologize for the mistake. We have recorded this, and we can make the recording available to you. Just, I guess, get an email to our website, and we'll give you the link if you need to. Sorry to interrupt.
oh, that's fine, that's fine. And one
Jean,
thing,
someone asked if alcohol affects can you store the tick in alcohol without affecting
that's
the
perfect.
Okay.
That's perfect. No, that would be great. That would be perfect. That would be really good. That's what we do. I mean, we use ethanol. And so I was going to say, that would be the best, actually. One thing that might be counterintuitive to folks is that the CDC and the Infectious Disease Society of America does not recommend that the tick gets tested for any pathogens. All right. And the skinny on that is that epidemiologically, they have found that knowing the infection status of the tick does not actually help improve knowing about the health outcome of the person. And I can talk more about that, but in part, it may actually cause people to be more concerned really than they should be. All right. And then on the flip side, you could also be lulled into a state of, false security too, depending on whether or not the tick is infected, is deemed as positive or not. But that's what the recommendation is, and that's what the doctors should be following as well. The important thing is to know what kind of tick that is. And then also, if you feel sick, the doctor should then proceed and treat based on clinical signs. So then the next part is, and why I'm going through this in this order now is, however, having said that, there are some places, and you now know, you could tell me in Michigan where the high risk areas for Lyme disease would be, but that in those places, if you do detect a tick within under these parameters, you can receive 1 dose of prophylactic antibiotics that will help reduce your risk of getting Lyme disease, whether or not knowing that tick is infected or not. All right. So the first thing was whether or not the tick is a Lyme disease tick. All right. And then number 2 was identifying the tick. Yeah, I have it that. And then number 2 is it in a high risk area? All right. And if it's fed for long enough to transmit. So let me just go back and say this again, that a high risk tick is the Lyme disease tick. It has to be Ixodes scapularis, the black-legged tick, and it should be a nymph for an adult female. All right. Then number 2, was it from a risky area? And although we're talking about Michigan, I wanted to just show you the national picture here for now, because I know you probably travel to hike in different places. All right. Right now, Michigan is considered low incidence, but if we were to zoom in, and doctors here in Michigan, they should be aware of, or you can provide them this information to make them aware, that there are certain areas where it would make sense to get prophylaxis. All right. So if it's from these areas that are darker red, darker blue on the left, or almost, potentially even in the other areas that are red on the map on the right, you want to show that to the doctors if they're not aware of. All right. And then the thing is whether or not the tick has fed for at least 36 hours. These pictures are from Tick Encounter again, and you can see how on the left, it's the unfed flat tick, and then it gets engorged as it goes to the right. And so 1.5 days is over here on the left where that yellow bar starts. And it could seem kind of flat, but under a scope or, even, over the magnifying glass, you can see that if it's a little puffy or not. And the same thing for the female over here. Now, the doctor and you, because it's going to be a shared decision when you're getting treatment, might consider saying, I can't tell if it's flat or 36 hours. And you can decide whether or not you would like to have the antibiotics now, or you'll wait to see if you get sick, because this prophylaxis, actually, it's only, they've only clinically had trials for the Lyme disease pathogen. So there is no recommendation for prophylaxis for any of the other pathogens. But again, none of those other pathogens are found in such high proportion as the Lyme disease pathogen. So this is the one that's, takes the most precedence in terms of or care, and concern. And then the last thing is, just to make sure, in terms of being able to get the prophylaxis is, did you remove the tick within 70, or did you go see the doctor within 72 hours of removing the tick? All right, because obviously if you pulled the tick out and it was before, it was between 36 hours and 72 and such, but you didn't go see the doctor for 5 days, well, the prophylaxis is not going to work. All right, because the pathogen, if it got in you, would have started reproducing. But at that point, you might start to be showing symptoms anyway, and then they would just treat you for a full dose regimen for treating against Lyme disease rather than prophylaxis. Right now, I know that this can be a little confusing, and I think it can be confusing probably even for physicians in the beginning, because they're not just concerned about Lyme disease, but concerned about all sorts of diseases. But the CDC has nice charts and such, and they should know. But I tell you this because this information is out there, and I'll have the links so that you're just aware of this and of these criteria, because you might think, why won't the doctor give me prophylaxis? Or should I be able to have it, advocate for myself, right? And so this information is, on the website and on the CDC website. And then they also have other graphics too to help with that. And so since you are avid hikers, outdoor recreationists, I just want you to know about this so that you can be informed to talk to your doctors about this. And no matter what though, even if you do get prophylaxis, you still want to monitor for signs of tick-borne disease, which we talked about before, mainly fever, lethargy, and such, because maybe even with that prophylaxis, you may have still gotten infected. Maybe you didn't, get it in time. Or maybe you actually don't have Lyme, but you got infected with the Anaplasma bacterium. So it's something else. Or it could be Babesia, something else, especially if you go to other areas, not just Michigan. And so you still want to monitor for disease and signs of disease and see your doctor. All right. And so here's one of the graphics, about what to do. They try, to, see if you should get antibiotic prophylaxis. And then here's just another a poster they also have to look at rashes for Lyme disease. So I'm just putting these here so you can know that there are these references, these resources, I should say, because now I'm pretty much wrapping up. And so these prevention messages, the take-home messages are, right now we don't have a vaccine, although there is one in clinical trials for Lyme disease. Having said that, right, we still have other tick-borne pathogens. And so, prevention is really something we should all be practicing. And if you go south, there'll be many more Lone Star ticks, and there'll be dog ticks other places. So regardless, it's the same sort of prevention advice, right? The do's and don'ts, partially, it's just like, don't flame the tick to try to get it out and such. Take it out and save it, for example. And then with regard to post-exposure prophylaxis of the ticks, there's information there. And so,
Dr. Tsao, someone asked for the website, the actual website. For information. You refer to a website. You're talking about the MDHHS.
Yeah. So I have at the end a picture of the basically the logos of these places, because writing it out and it's people might not, well, you can't copy and paste, but I would just say the state health department, MDHHS, that's one place. The CDC is another place, and you just do the Google search on them and type in Lyme disease, and you'll end up at the right places for getting information, right? And then I have the pictures at the end again to remind you guys of the other websites that I've been talking about. I wanted to just end a little bit with these, thinking about dogs, and someone talked about something else, but this is actually my dog. But these were here in Lake Lansing, but I have nice pictures down at Fort Custer and at the Kellogg Forest. But one of the things is that dogs are actually 6 times more likely to pick up ticks than we humans. And from a research standpoint, we often use dogs, just like I showed you with the serology, to help us understand where are places of risk. But I think lots of people get worried about their dogs getting infected with the tick-borne disease, and also dogs picking up ticks and bringing them to us. And so certainly I would say talk to your veterinarian to be able to find a product, an anti-tick product. Many exist that they and you would like. Some dog breeds don't tolerate some products as much as other dog breeds, but there are lots of products out there. And just know that my recommendation, if you're worried about your dog getting having ticks that might come off on you, is to make sure that you get a product that actually it's systemic within the dog, and that the tick has to bite the dog. So it's not repelled, but it has to bite the dog to take in the toxin. All right, because then the tick dies on the dog and it's not coming off the dog and looking for another host. All right. But that won't prevent the male ticks. Remember, so the male ticks, the Lyme disease ticks, they don't feed. That's why they're not a risk for infecting us, right? So that type of drug won't stop male ticks from running around. And so you might get a little worried about that, but then you just have to remember, oh yeah, I heard this talk. The male ticks don't bite us. So they're not really vectors. So you don't have to worry, all right? And so here's just information about if you would like to get the Tick app. I put a QR there, but you can just go to Google Play or the Apple Store, wherever you get your apps. All right. And so there's information there, and you can take a picture, of the tick, and someone will get back to you. An expert will get back to you, tell you about it, and to give you a little information about whether or not, you might be worried about it having transmitted a pathogen to you or not. They'll try to get get a sense of the engorgement levels. And so with that, I was just going to say, that's really it. So thank you. These are a lot of the people, students I've worked with running around the states, collecting information on ticks. And then this is the slide that I had, just, these logos that then if you just look them up online, you'll find information about that might be helpful to you.
So Jean, there were some questions early on that we kind of glossed. We didn't really hit, I don't think. There was a couple of questions about, we have eradication programs for mosquitoes where we spray communities or areas that are high mosquito rates. Is there any plans to do something like that for ticks in the future? Because we're obviously not getting less ticks over time.
Yeah, so the CDC, this is really active area of research for the CDC, the USDA, NIH has a hand in this too, but we're just like somewhat decades, behind the research and technology available for eradicating, if we actually are eradicating mosquitoes. And also ticks in some ways, although if we had more decades of research, it'll help, but ticks are harder actually to eradicate because the ticks are underneath the leaf litter often. And so you can't just spray something, right? Like the way they do for mosquitoes. Mosquitoes are flying and they'll get a droplet on them, or it'll land on resting mosquitoes in the vegetation. All right. But these ticks, actually, my students have done research actually out at Lux Arbor, which is part of KBS and other places. About 2% to 5% of ticks are actively host seeking above the leaf litter at any time. So you'll maybe kill some of those, but what you really need to do is to use a sprayer that has high power and really get under the leaf litter. The leaf litter has to be disturbed. That's if you want to go with that approach. Other approaches people have talked about controlled burns. So these ticks are really prone to desiccation. So if we can burn the leaf litter, a bit more, then that's one way to reduce risk. That could help even for habitat restoration and such. But in many places, there are arguments against, or people's preferences and values are such that they don't want to have all these burns, going on,
Sure.
right? Unless it's for prairie restoration, right?
And what about, dogs have vaccinations? When are
That's
we
right.
going to get ours? It's
Well,
just not fair.
Well, there is one out right now in their phase 3 clinical trials, which is towards the very end, and that might then come out onto the market in the next few years. But having said that, again, it is Lyme disease, which is the leading tick-borne disease. That's great, but we still would want to watch out for these other pathogens. So spraying will still work. I mean, if you get a pest management person to come, they can apply some insecticides, or we say acaricides, against ticks on your property, like a barrier spray, and they'll do it in a way that should be more effective. These sprays, I think they can break down quickly, relatively quickly in time, so that they're not hanging out there and killing a lot of other arthropods, right? But so some people may elect that if the risk is high enough, they would like to have these sprays down in their yard. All right. But some people, because they have these acaricides have non-target effects, don't necessarily want them. And that's one reason why probably, parks aren't willing necessarily to use them unless you have a public health emergency, right?
Okay.
You can, deer are really important. Deer are not reservoirs for the pathogen that causes Lyme disease, but without deer, you really won't have, a very high tick population in order to maintain this Lyme disease pathogen. So some places have gone to a deer control program, but you have to get the deer numbers down to such a low density that really, again, communities usually aren't willing to do that. There have been some situations like in an island off of Maine and some other areas in New Jersey and Connecticut where they have asked for the sharpshooters to come in to really cull the deer to a low number. But, you have to continually do that.
I lost the volume.
And so, that's again, not.
Thank you, Dr. Tsao. Very informative. Good night, all.
Oh, thank you.
Dr. Tsao, do you mind if we move on with our meeting, or
Yes.
do you
I mean,
I don't know.
I'm.
I think what I've written down, I think we've covered an awful lot of ground. There was some great comments too.
Oh, yeah. Thank you so much. And I'm local. So, and I also just wanted to say, I told Cynthia and Eric, I will be speaking at the Quiet Adventures Symposium, and I'll have a booth or two. I'll actually give people a chance to search for search for ticks on some mannequins. And so if you are there, please come by and I'll be happy to answer any more questions that you might have.
Absolutely.
This is Deb, and I've got to sign off too. But I just got to say, Dr. Jean, I just loved the informative, so much information tonight. And yes, I was the one with all the dog questions, but thank you very much. And sorry, I got to miss the rest of the noonday meeting, but take care. Thanks a lot. Great meeting. Bye-bye.
Hey, Dr. Tsao. We want to present something to you as a memento of our appreciation for you coming to visit us. Would you believe, we have an NCT sweatshirt that we're going to send to you. So we'll communicate on email for you to send me your mailing address. I made sure it wasn't blue, but they didn't,
Right.
except for the NCT blue, but there was no green.
That's fine. And I'll be happy. I've seen the NCT trail at the Kellogg Biological Station, and I've never actually gone on it. And so I'm going to do that. And, I'll be thinking of you guys.
Well, there's about 70 people here who would be glad to go with you.
Well, I'll have to look on your website and such to see when you have another planned hike together or someplace and try to join you.
Great. Sounds wonderful.
Thank you very much.
Yep. Thank you, everyone.
Thank you so much. Okay. Thank you.
Bye.
Bye.
So that is the end of our speaker. And for those of you who joined a little bit later, well, first of all, I'm Eric Longman, and I'm the vice president and kind of in charge of this meeting tonight. We are recording this. If you did come in late, we will try to get you, we do make a recording and I don't know how to make it available to you. We do have a Facebook page. If you send us something on the Facebook page, check our website page. We should be able to give you the link, but it's probably going to be ready tomorrow or the next day after. So you can watch this again if you need to. So we thank you all for attending. We are going to get to our business meeting, which will be short and sweet. If you want to stay on, if you just listened for the ticks, you can get off of that now. And I guess at this point, Dr. Tsao, thank you very much for your time.
As far as the recording goes, it's available only for 30 days at this time, unless the national office decides to put it up on their website, which
They
may
have,
be
they have
doing.
asked about, they have asked to do that, but certainly we
So-
will put a link on our Facebook page, right?
Right. We will have it, but it takes 24 hours for us to get that. Thank you for your indulgence.
Thanks,
Yeah,
Mary.
I have somebody from the Chief Bobby's group, that Nikki, that works with tick research, that is very interested in seeing the recorded things. So I've sent that information to her. She'll be in contact with you guys for more information.
We know her, so that's great.
There you go. Okay, thanks. Good seeing you, Eric. Bye, everybody.
Thanks a lot. All right, so we've got a lot to cover in a fairly short time. Now I'm seeing a lot more familiar names and faces, and because of the time frame, I'm not going to go around to ask for introductions for people today, but welcome to all of you. And if you're not Chief Noonday, we are a pretty active chapter and we've got a lot of stuff going on. And somewhere we might even have an agenda that somebody can post. And I'm new to Zoom, so I'm just hanging on by my toes right now to try and get this done. Oh, I did want to say, I challenged people that were on at the beginning to make a joke about 2 ticks going into a bar. And our speaker said, they asked, what type of blood do you want? And somebody else said, do you want to order 2 Bloody Marys? Which I thought was kind of an interesting joke for ticks, but what do you say? So anyway, Cynthia, I don't know how to get a agenda up here, but basically we are looking for any additions to the agenda, and I wanted to talk briefly about Hike the County, and Mary wanted to talk about picnic tables in February. So Mary Reber, later on, you're going to be talking about picnic tables, and we're all going to join you for a picnic, I guess. We do have the minutes of December 14th that have been floating around now for a couple of months, and we need a motion to accept the minutes as written. And I read them and I thought they were very good for Jim Bronson to do. So I will make the motion if I can. Anybody second?
Second,
Was that JP?
Dana.
Dana, good for you. All in favor? Aye. Aye. Thumbs up, whatever. Okay, good deal. And then I don't think Julie Smith, well, Dana, do you have a treasurer report that you want to very briefly
I do have
do?
a treasurer report, and I talked to Julie yesterday, and I don't know if I see her on. Julie, are you there?
I haven't seen her name.
Good.
Oh, okay.
Okay. A little dark, and it says Samsung. So
Yeah.
my last meeting as treasurer, I did not transfer everything over to Julie yet. She wasn't getting the report, so it's kind of unfair for her to give a treasurer report.
Thank
She knew
you.
nothing about it. So I'm happy to go out on a high note, I guess. But yep, Julie is the incoming treasurer. She'll be the person that you send any expense reimbursement reports to. I will get over her email address to you, Jim. And or Julie can tell us how else she would like those expense reimbursement reports or other bill reports. But yeah, so this is my last treasurer report for the month. And now I don't have it up in front of me. Hold on, please. Got it. So for the month ending December, as a reminder, as I always say, we get the reports about 2 weeks into the month. So I'm always about a month behind, but the end of December 31st, we had $13,038.77 in the checking account. The only transactions for the month, there were no expenses. There was one specific donation made to the chapter. And then we had our semi-annual member donor share So basically the share of our, the Trail Association wide membership that gets split based on how many members we have. That was $1,848. So that is it for me. Yeah, anyone have any questions about the finances?
I would just say I kind of got some information on that, and I know that there was a donation, I believe, Dana, of $100 in honor of Arlene Steinley, and I'm not exactly sure who or why, but somebody appreciated the work that she did. So congratulations to Arlene for that. Am I correct on that, Dana, as far as you know?
In honor of Arlene Steinley. Yep.
Yeah, okay, good. And also I'd say the reason we have a very nice amount in the in treasury right now is largely because of Larry Bell's donation to the different chapters around the NCTA. We usually do not carry that much money, but it's very nice to have that for some projects that we have going on in the future. So thank you, Larry Bell, if you happen to be listening.
Absolutely.
And I don't know if do I need to make a motion to accept that treasurer report or anything? Yes.
Yeah.
Mary says, yes, I need to somebody needs to make a motion to accept. All right, Joanne Mort is making a motion. Anybody second?
Second.
I'll sit down.
I think JP just seconded. All in favor, raise your hand, say aye. Aye. Okay, good deal. Julie, you see how that's done now, right?
I do.
Short and sweet.
Okay.
Thank you, Dana.
You're welcome.
Yeah, thank you, Dana, for everything you've done. Thanks for all your service.
Yeah,
Yes,
appreciate that. Next is the upcoming events. We've got a work day that's tentatively planned. We won't have one in February for work days, but we do have one tentatively planned for March 18th. We're going to aim for the third Saturday of the month for work days. And we may be trying to break open the new reroute that gets us back off of EF Avenue down near Augusta and onto the Kellogg Forest and get rid of that or get done with the road walk that we had to have when we lost that property a couple of years ago. So that's kind of exciting to have that taking place. And we don't know if that'll be ready yet, but we're hoping that we can do that on March. We've got a couple of hikes coming up on March 11th. We'll be meeting at Ned's north end of Gull Lake to hike to Chief Noonday's gravesite. You'll be getting notices on that. And that will be at 10 o'clock in the morning. And then we'll probably have some refreshments at Ned's after that hike. And then we have a hike, the Bluebell hike, I believe is scheduled for May 6th. And we have a full moon hike on April 6th. So we've got those coming up too, but those are available on our events calendar on the North Country Trail Association events website. New business. We are going to let Jim talk a little bit about the Marshall mega site, but he's going to do that later on when he's talking about some of the other stuff he's involved in. And we do have chainsaw training that's going to be in June for our new sawyers. We got a full batch of people that have stepped forward and are going to work on that. And I think I see a couple, David Irvin and Tom was here. I don't know if he's still on or not, but we've got a couple of people that are new that have signed up for that chainsaw so we can keep the down trees clear and make sure that we can get through the trails, which is really great. Old business. We sent out with the minutes, with the agenda, we sent out a list of 1 and 5 year goals. And if we're looking for champions to fill those out, I'm not going to go through those goals today. If you want them, you can send me an email, and most of you have my email, or just send the chapter an email. But we're looking for champions that will just kind of work those through, not actually do the work, but just kind of follow them through and find people and help us to get those things done. A lot of them have already been filled with champions. And after I sent that agenda out, I did get Valerie Slaughter, who said she would be helping to write some articles. So one person's already stepped up, and that's kind of nice to hear. We have trail protection now on old business for Jim. So I get to take a breath and let Jim talk. And you're muted.
I know. Let's see. The first thing, I guess, is Jane and I have been working with County Commissioner in Berry County to hook up with a landowner outside of Middleville. And I talked about this a little bit in the last meeting. We did finally hook up with John Rock who is the private landowner, and Catherine Getty, the commissioner. And we had a really nice conversation with Mr. Rock, and it looks like we're going to be able to work with him. The next step would be to work with the village of Middleville to see if we can come across some of their property, which lies behind the water treatment plant. It sounds like ultimately a lot of the property in that area is going to hopefully be turned into a city park, I guess, or something, a township park. So we have a fair chance of being able to go through there, I guess. But what this would do would allow us to eliminate the Crane Road roadwalk, and we'd take a little bit different route through Middleville, ultimately getting back to the Paul Henry Trail that we used to get out of town. So that's we haven't had a meeting yet with the village, but I believe Catherine Getty's setting that up for us, and so hopefully that'll happen soon. Jeff Fleming and I met with KJ, Ken Kettler down at Kellogg Forest earlier in the week, or late last week, I guess, just to talk about how we might open the old route back up now that we actually own that little piece of property that was owned by the Sacketts off EF Avenue. And it looks like we're good to go there. It's just a matter of kind of getting organized with him. And so as Eric mentioned, we got a little work to do on the old Sackett property because we haven't been on that piece of trail for over a year now, or about a year. But I was out there today and it's actually not in bad shape. So if we get a few folks and a chainsaw or two, we should have that ready to go in the morning, I think. So I guess I'm supposed to talk a little bit about the mega site development. If my voice holds out.
I can do it if you can't.
For those of you that aren't familiar with it, there's about 1,600 acres that are up for development in southeast of Battle Creek, actually between Ceresco and Marshall. And it has some interest for us because the land that's potentially being developed or talked about for the development is on both sides of C Drive, which is our road walk to Marshall. So
it's supposed to be about 10.
The update that I got from Doug Farrell, the county parks director in Calhoun County yesterday, said that he told me that a lot of that land, potentially the sale for it would be taking place this week. I don't know if it's the entire development area, but the piece he was talking about is between the railroad track south of C Avenue and the Kalamazoo River. That would be part of the sale that might happen this week. That property would be bought by the Marshall Economic Development Association. The long-term hope is that some of that land down by the river might be developed into a trail, but that's not a done deal. None of this is a done deal. There's a lot that could happen. And Doug wanted to be sure that we let you know that the Parks Department is staying on the sideline of this right now because of the political volatility over this entire development. It's a huge deal. Some people want it, a lot of people really don't want it. And so the Parks Department's just staying on the side. They're not pushing one way or the other for any of this because they don't want to get pictured as somebody that wants this development just so they can have a trail. That's not the situation. And so if it comes up, make sure that you understand that. Let's see. I think that's all that we really know at this point. There's a lot. This development still may or may not happen. it's got some momentum right now, but there's still a lot of local meetings to happen and that kind of thing. And so we'll see what happens. That's what's going on at the moment.
And we did, thanks, Jim. And we did talk about this at the board meeting in January. And it was basically, it's so new that we as a chapter are going to keep quiet and stay by the sidelines too, which is basically what Jim was saying. But if you have personal opinions, then you have personal opinions, but please don't speak on behalf of our chapter or the North Country Trail itself. But it's a very, very big, if you haven't been aware of it, it's a very, very big project of possibly industrial sites moving into that whole area. And so there's a lot to be considered there. Let's see, NCTA awards, North Country Trail Association awards. Mary, you want to talk briefly?
Yes, I just mainly want to make all of our members aware that it's a great honor to be nominated and especially to be given an award from our local national association for the NCTA. They have many different categories, and all I want to do is just I'm going to read through them real quickly. Please, if you think of anyone that you work with on the trail, whether there's someone that's a active member or someone from behind the scenes that could possibly qualify for any of these type of honors, it would be wonderful if you just let me know. The categories are leadership, outreach, trail maintainer, communicator. They have a boots on the trail, which is someone that comes in and helps out with different things without hardly being asked. They have a sweep, and that's the person that's always available for the hikes that, helps keep people interested. They have a landowner. If any of our landowners come to mind, we've already given one to the Chef Center. We've given one to the Circle Pines. And this is great. Hopefully we can consider Bear Creek, which is one of our newest landowners that has opened the trail up. And then also a government unit person. If we've worked with, let's say, the city of Middleville or even Augusta or someone that you feel helped in promoting that community to be a trail town or speaks up for the trail, the national office has a special award for them. So that's all I need to say.
And those descriptions are also on the NCTA website if you want to read more about the type of person that you'd be nominating for both of those. And Mary, you want those, or somebody, Larry Pio, I guess, is collecting them. And toward the end of May is the deadline for submitting those?
Right, May is the deadline. And it's an online form that you fill out. And essentially, if you're thinking of someone, you think of the things, why would you say that person is a communicator? Were they the ones that went and passed out flyers? Were they the ones that contacted newspapers, that sort of thing? In fact, Eric did get an award for that once for his newsletter. So if you go online, it's really helpful from the NCTA website because it's listed, and you have to go to volunteers because we're all volunteers. It's listed exactly what the description of each award is.
We usually have a good number of people from our chapter that are recognized in the national get-togethers, and we've got a lot of great volunteers, so it's nice to reward and recognize those people. Mary, you needed to talk about picnic tables.
Now, while I'm here, yes, we were donated a dozen picnic tables, and we've been placing them throughout the trail as we decided, but we have 3 tables left. So we'd like to get them out of Eric's barn and onto the trail. If you think of a place where you feel that a picnic table would be useful, we need to have that. I have listed, I'm wondering about near the Audubon on 108th Street, or maybe in the Chef Center, or maybe even Bear Creek. Those are 3 of my thoughts. But I'm thinking you folks are out on the trail day in, day out. If you've been around a spot, you've probably seen a picnic table if you've been anywhere in our county, because we do have them in each of the counties, up to 9 of them, but we have the last 3 we want to try and place. Let me know.
For those of you who are new to our chapter, I have to tell you that Mary is talking from Alabama, which is why we can see that she does not need the coats and the sweaters that all the rest of us are wearing. Okay,
Wait,
thank you very
No,
much.
listen, the worst part is this central time zone situation and Facebook. I'm telling you, Facebook's driving me crazy. I put in the right time and then they switch it because I'm sitting in central. So unfortunately, it's caused grief for many people and I apologize personally. I'm trying to work it out. It's one of those electronic things, you know.
You would choose to blame Facebook and not you, Mary. How about if we just do it that way?
Okay.
Joanne, I don't know if you're ready to talk about Bridge Walk, but that's the next thing on the agenda.
I am. So we are planning to walk the Mackinac Bridge for Labor Day. It is 5 miles in each direction. You can turn around whenever you want to now. The bridge is closed completely to traffic from 6 a.m. till noon. You must be on the bridge by 10 to be allowed to walk. And I think you have to be halfway, and I'm sorry, I don't remember that. So we are looking at getting a block of rooms. I'm going to try for Roadway Hotel because it is right at the foot of the bridge and that's where they all meet before you start walking. So that's my first goal that I'm trying to get. All the hotels are closed until end of April, first part of May. So first, before I put any effort into trying to find a block of rooms, I want to find out how many people are really interested. And then we can talk about, are we going to carpool and how long, if you want to stay Sunday night and Monday, just Sunday night. The rooms will probably run pretty close to $250 a night. So that is something to think about. Monday night being Labor Day may be cheaper because everybody leaves by that time. So if you can email Eric or myself, that would be appreciated so we can get an idea if we need to move on with this. Brett and I hiked it this past year and we did both ways. So that's 10 miles. Plus we walked to our hotel and back. So that day we hiked 13 miles, like 30,000 steps. It was a great day. We took our bikes with us. We spent 2 days, 2 or 3 nights up that way. And we had a lot of fun. There are a lot of people and they do a lot of activities. So it'd be great to have a whole group of us to hike it.
And this isn't going to be a totally formal, we're not going to march together in lockstep or do anything like that, but it's just a group of the chapter members that want to get together perhaps for dinner before and then kind of meet up in the morning and try to coordinate traffic, and maybe somebody can sleep on the floor of a hotel room if they don't have a place to stay to share the cost, stuff like that. So it's not totally formal, but it's just, we want to get a group of a list of names of people who might be interested. So thank you for that, Joanne, and for stepping up. And Arlene, I don't think she's on tonight, but she's working with you as well. So thank you for that.
And the bridge is the North Country Trail.
Yes,
So it goes towards your 100 miles. Definitely. Every step.
And that's how we finished our 100 miles last year. We did the 10 miles on the bridge. We had planned that to be our finish.
And then we walked more after that, but
yeah. Yes.
And the next thing on the agenda is the Quiet Adventure Symposium, which again, Joanne is stepping up to the plate to organize a table, a booth that's going to be there. So you're back on.
Thank you. That is coming up next month, March 11th. 4th, March 4th. I'm sorry, I have it written down right here. March 4th, from 9 a.m. to 5:30 at the Michigan State University Pavilion. And I have that address. It'll all go out. Tickets in advance are $15 each. At the door are $20. We have 4 chapters from North Country Trail that will be represented there. We will have flyers. We're going to have some things that could be interesting to do. The last time this was put on, they had 2,300 people in attendance. There are a number of guest speakers, and Quiet Waters, it used to be Quiet Waters, now it's Quiet Adventures. And it is offers hands-on activities for youths ages 5 to 11. I understand there's also a lot of adults that will be there. It's about environmental and outdoor education projects and topics such as environmental resources management, outdoor recreation, and education. So the idea is that boating, hiking, boating without motors, kayak, canoeing, hiking, anything that you could do outdoors will be represented in here. So it could be a fun day. If you're in the area, we understand some people are not. Definitely make a trip up to Lansing and hang out with us for the day. At least 4 or 5 of us will be there for the whole day. Plus, I don't remember right off the top of my head the other 3 chapters. Maybe Eric remembers that will be there.
No, but if you haven't been to this event, trust me, it's got a lot of great breakout sessions. It's great to just view the different types of kayaks, bicycles, hiking equipment, canoe liveries, just all sorts of different booths. We've had really good success and we've had a lot of fun. But even if you're not going to volunteer at the table, you can definitely worth the $15 for the entry fee and then visit and do some of the breakout sessions. It's just a great day, a great event, and it's not that far away for us. So that's a good thing. One last thing on old business, I want to talk about the Hike the County challenge this year. We got the approval from the board. This is high tech here. Watch this very carefully. We got the approval from the board to order new patches this year. And this is the new patch.
All right.
That is, well, the order went in today. And yes, thank you very much. And thank you for the board for that. And we are having a photography contest. If you are not receiving our newsletter, there was a little notice in the newsletter last time when it went out, but each season of the year, we are going to accept photographs that you take along the trail. And if you want more information on that, you can send an email to hikethecounty@gmail.com. If you don't know about the challenge of hiking just one county of the 3 that we cover, you get a patch, you get a certificate, and you get a good feeling inside, and you get a lot of exercise. So Kalamazoo is only 13 miles. It's not that difficult to do in a full year. So that's all that I want to say about the Hike the County, the photo contest. Start taking good pictures. Past events, I want to mention that the Gilmore Car Museum Christmas tree, where you drop off food for the poor underneath the tree, our chapter won again this year. I think we won it 2 years ago. We lost last year. This year we went all out. We won. We get bragging rights and we get to choose where we want to put our tree next year, assuming we want to do it again. So if you brought food, thank you all for doing that. Mary's smiling. Did you bring food this year, Mary? Even though you were still up here north when that went on, I think.
I gave
Mary?
it to Jane. Yeah,
Okay,
we had it
good
at the November meeting.
So anyway, we are the winners for that. And we have had some good hikes, Veterans Day hike, the Middleville Christmas Parade, which Joanne brought a whole bunch of her grandkids and we marched through and welcomed Santa Claus in before Christmas. Was a very nice event. I guess that's about all. How about any other people want to bring any topics up right now?
I want to just say thank you to Cynthia. She is our new program chairperson. And I think she's doing a wonderful job. It was a great program. We had a lot of interest. And I know it took a lot of effort to get it together. I really appreciate it.
I agree.
Well, it's nice to set up the programs that you want, right?
There is a benefit to that. Yes, absolutely. Anything else? Thank you all for joining. Oh, Joanne.
If anybody else has an idea for a speaker, please let me know.
Okay, Cynthia, thank you. Joanne?
Another activity we have coming up is Youth Day, and that will be in August in Battle Creek area, Charlton Park, and you'll get more information as we get closer.
Anybody else? Going once, going twice? Thank you all for joining us. Have a good evening.
Thank you.
Take care. Yep. Oh, we need a motion to disband this. Anybody want to make a motion?
Anybody? Move we end the meeting.
I second.
I think I recognize that voice, Dana. Okay, all in favor? Yes. Okay,
Yes.
thanks a lot. Take care.
Thanks, Eric.
Good night,
everybody.
Good night.